I'm Dr. Gulzar Ahmad. I'm a gastroenterologist and hepatologist. Today, the topic of discussion is non-alcoholic fatty liver disease, or which is also simply called as fatty liver. First of all, we'll describe why it is called as non-alcoholic. Commonly, the fatty liver is caused by intake of alcohol in excess quantity. But if fatty liver occurs in a patient who does not consume alcohol, we call it as non-alcoholic fatty liver disease. Normally, the liver, it contains up to 5% of fat, but any quantity of fat which goes beyond 5% is called as fatty liver disease. Fatty liver disease is more common in patients who have overweight, obesity, who have other metabolic derangements like dyslipidemia, who have hypertension, who have diabetes, and other metabolic derangements. It's also more common in Western countries than developing nations because of more prevalence of metabolic syndrome in those countries. If we talk about Asia, around 25 to 30% of patients, people, they have fatty liver disease. And if they have overweight and diabetes, it can go more than 50%. Now, coming to what is simple fatty liver disease and what is non-alcoholic steatohepatitis. Once, if patient has only fatty liver disease, it does not have any abnormality in liver function, the fibroscan does not show any advanced fibrosis, or if anyhow liver biopsy is done for some other purpose and it does not show any inflammation, that is simple fatty liver disease. Once it progresses one step more, there is inflammation of liver along with fatty liver, and those patients, they have high liver enzymes. ALT usually is raised, and on liver biopsy we can have features of liver inflammation. With inflammation, usually patients they develop fibrosis, and it progresses from simple fatty liver disease to NASH, which can in turn lead to chronic liver disease and liver cirrhosis. It's important to mention here that in coming decade, the fatty liver disease will be the leading cause of chronic liver disease in all over the world. If we discuss regarding the diagnosis of the fatty liver disease, it can be picked up by a simple ultrasound. But once ultrasound picks up the fatty liver disease, it's already the liver contains more than 25 to 30% of fat. We can have simple liver tests like AST, ALT will be raised. Patient will have dyslipidemia. And if we'll go for a fibroscan or elastography with any other method, it will have higher values. Like if we talk about fibroscan, it will give us the quantity of fat in decibels per meter, and it will give about the stiffness, which is represented as E value. So based on these things, we diagnose the fatty liver disease. Prior to that, we should also know what are the symptoms of fatty liver disease. These patients, they may be altogether asymptomatic. Usually they have these risk factors like they have overweight, they have diabetes, they have obesity, and they have dyslipidemia. These are the patients who are at risk to develop fatty liver. Then, if we talk about the symptoms, the symptom may be mild right upper quadrant discomfort, or there may be some dragging sensation, or patient may be asymptomatic at all. Only these investigations may show abnormality. Or in advanced fatty liver disease, when it progresses to chronic liver disease and cirrhosis, the patient can have full-fledged symptoms like vomiting of blood, can have ascites, can have jaundice, and can have other overt symptoms. Coming to the treatment and prevention, presently there is no curative treatment for fatty liver disease. The main stress we give on lifestyle modification, like if patient has overweight, he has reduced the body weight to bring it to normal level, or at least he has to reduce the 10% of the weight, which will significantly improve the metabolic parameters of the patient and liver histology. But main stress is on lifestyle modification and dietary habits. If we are taking too much of carbohydrates, we have to reduce the carbohydrates intake and reduce the fat intake. We have to reduce the free sugar consumption. All the products which have high sugar contents, they should be avoided by the fatty liver patient. They should at least do 30 to 40 minutes of exercise per day. This all will lead to improvement in the patient profile as well as fatty liver disease. Thank you.